Borax to go. The easy way to pain relief. Introduction to borax. Borax, also known as sodium borate, is a naturally occurring mineral that has been valued for centuries in various cultures and applications. In chemistry, borax is known as a boron compound, which has a variety of industrial and medical uses. In recent years, borax has received increased attention due to its potential health benefits, particularly as a pain reliever. Borax is a white, crystalline powder that is easily soluble in water. It has a long history as a cleaning agent, preservative, and ingredient in glass and ceramics manufacturing. But in addition to these traditional uses, borax is increasingly being researched as a pain reliever and treatment for various health conditions. The use of borax for pain relief is based on its ability to reduce inflammation and affect nervous system functions. Many people suffering from chronic pain have reported that borax has helped them relieve their symptoms and improve their quality of life. These positive testimonials have sparked interest in borax as a natural and inexpensive pain reliever. In this book, we will take an in-depth look at the various aspects of borax, from its chemical properties and historical uses to modern scientific studies and practical applications. The goal is to give you a comprehensive understanding of how borax can help you live pain-free. The chemical properties and composition of borax. Borax is a compound made up of boron, sodium, hydrogen and oxygen. The chemical formula of borax is Na2B4O5O4 which means it consists of 2 sodium atoms, 4 boron atoms, 5 oxygen atoms and 8 water molecules. This unique composition gives borax its special properties that are used in various applications. Borax crystallizes in a monoclinic system, forming soft, colorless crystals. It has a density of about 1.73 gcm3 and a melting point of 743 degrees Celsius. At room temperature, borax is stable and retains its crystalline form, but it can be dissolved in water to form a weakly alkaline solution. This alkaline solution is one of the secrets behind borax's effectiveness, especially in pain relief. The chemical properties of borax allow it to act as a buffering agent that can stabilize the pH of solutions. This is particularly useful in various industrial and medical applications. In addition, borax has the ability to bind heavy metal ions, making it a useful agent for water treatment and toxin removal. Another important aspect of borax's chemical properties is its ability to affect cell membranes. This may help regulate nervous system functions and reduce inflammation. These effects are why borax is being researched as a potential pain reliever. In the following chapters, we will look in more detail at how these chemical properties of borax can be used in medical practice to relieve pain and improve health. Historical use of borax in medicine. The use of borax in medicine has a long history dating back to ancient times. In various cultures, borax has been valued for its versatile properties and wide range of uses. Historically, borax has been used in traditional medicine primarily as an antiseptic, to treat skin conditions, and to relieve pain. In ancient Greek and Roman medicine, borax was used as a remedy to treat skin infections and wounds. Hippocrates, considered the father of modern medicine, mentioned borax in his writings as an effective agent for disinfecting and healing wounds. Borax was also used in traditional Chinese medicine, particularly to treat inflammation and as part of herbal mixtures to promote healing. Borax continued to be used in Europe during the Middle Ages, particularly in alchemy and early pharmacy. It was often used in ointments and tinctures to treat skin diseases and aid in the healing of injuries. Borax's antiseptic properties made it an important ingredient in medicinal preparations of the time. With the advent of modern medicine and the development of synthetic drugs, the use of borax in Western medicine fell into oblivion. Nevertheless, it remained in the folk medicine of many cultures. In some regions of the world, borax is still used as a traditional remedy today. In recent decades, there has been a resurgence of interest in natural and alternative remedies. Scientific studies began to examine the traditional uses of borax and explore the biochemical mechanisms that might explain its health benefits. This research has shown that borax does indeed have anti-inflammatory and analgesic properties that support its historical use in medicine. In modern applications, borax is often used as an ingredient in dietary supplements and natural pain relievers. Borax is believed to be able to relieve pain through its effects on cell membranes and modulation of inflammatory processes in the body. These effects make it an interesting candidate for the treatment of chronic pain and inflammation. Scientific studies on the effectiveness of borax. Scientific research into the effectiveness of borax as a pain reliever and therapeutic agent has gained momentum in recent years. Numerous studies have looked at the biochemical properties of borax and its potential health benefits. This research has shown that borax has anti-inflammatory, antioxidant and analgesic properties that could make it an effective agent in the treatment of pain. One of the most significant studies on the effectiveness of borax was conducted on rats to examine its anti-inflammatory properties. The results showed that borax reduced the production of pro-inflammatory cytokines and significantly attenuated the inflammatory response. These results suggest that borax may have a similar effect on inflammation in the human body. Another important area of research is investigating the effect of borax on bone health. Studies have shown that borax regulates calcium and magnesium metabolism in the body, which is crucial for bone health. This is especially relevant for people with osteoporosis and other bone diseases, as borax may help increase bone density and reduce the risk of fractures. A clinical study on patients with rheumatoid arthritis showed that daily intake of borax resulted in a significant reduction in pain and joint inflammation. This study provided valuable evidence that borax may be effective in treating inflammatory diseases of the musculoskeletal system. Another interesting area of study is the neuroprotective effects of borax. Research has shown that borax can reduce oxidative stress responses in the brain, making it potentially useful in neurodegenerative diseases such as Alzheimer's and Parkinson's. These studies are still in the early stages, but the results so far are promising. Overall, these scientific studies suggest that borax may be a versatile and effective remedy for pain management and promoting overall health. However, it is important to note that more research is needed to determine optimal dosages and methods of use, and to fully understand the long-term effects of borax use. Borax as a painkiller. Mechanisms of action. The mechanisms of action of borax as a painkiller are complex and involve several biochemical processes in the body. Borax works mainly by modulating inflammatory processes, regulating calcium and magnesium metabolism, and influencing nervous system function. These multifactorial mechanisms of action make borax a potentially effective pain reliever for various types of pain. One of the main mechanisms by which borax relieves pain is by reducing inflammation. Inflammation is a common cause of pain, especially in chronic conditions such as arthritis. Borax works to reduce inflammation by inhibiting the production of pro-inflammatory cytokines and prostaglandins. These molecules play a central role in the development and maintenance of inflammation and pain. By inhibiting their production, borax can reduce the inflammatory response and the pain associated with it. Another important mechanism is the regulation of calcium and magnesium metabolism. Calcium and magnesium are crucial minerals for nerve and muscle function. An imbalance of these minerals can lead to muscle cramps, nerve pain, and other painful conditions. Borax helps regulate the balance of these minerals by improving the absorption and utilization of calcium and magnesium in the body. This can help relieve muscle and nerve pain and support overall nervous system function. Borax also has direct effects on the nervous system. Borax has been shown to reduce the excitability of nerve cells, meaning that nerves are less sensitive to pain stimuli. This may help reduce pain perception and increase the pain threshold. Borax may also affect the release of neurotransmitters involved in pain transmission, further aiding pain relief. In addition to these mechanisms, borax has antioxidant properties that may help reduce oxidative damage in the body. Oxidative stress is another factor that may contribute to chronic pain. By neutralizing free radicals, borax may help prevent cellular damage and promote tissue health. Overall, the mechanisms of action of borax as a pain reliever are versatile and include anti-inflammatory, mineral regulating, neuroprotective and antioxidant effects. These mechanisms contribute to making borax a potentially effective analgesic for various types of pain. Applications of borax for various types of pain. Borax can be used to relieve a variety of types of pain, including joint pain, muscle pain, nerve pain, and general inflammation. Each type of pain requires a specific application and dosage of borax to achieve the best results. Joint pain. Borax is particularly effective in treating joint pain caused by inflammatory conditions such as arthritis. The anti-inflammatory properties of borax can help reduce swelling and pain in the joints. To treat joint pain, it is recommended to take borax in supplement form or use it in topical creams and ointments that are applied directly to the affected joints. Muscle pain. Muscle tension and cramps can be caused by an imbalance of calcium and magnesium. Because borax regulates mineral metabolism, it can help relieve muscle pain by restoring the balance of these important minerals. Borax can be used in the form of baths or as a dietary supplement to relieve muscle pain. Nerve pain. Borax may also be effective in treating nerve pain caused by conditions such as neuropathy or herniated discs. The neuroprotective properties of borax may help reduce nerve pain by reducing nerve cell excitability and supporting nervous system function. To treat nerve pain, borax can be taken orally or used in topical preparations. General inflammation. Chronic inflammation can cause a variety of health problems, including pain and discomfort. Borax can help reduce this inflammation by inhibiting the production of pro-inflammatory molecules. For general inflammation reduction, borax can be taken as a daily supplement. Topical uses. Borax can be used in topical preparations such as creams and ointments to treat local pain and inflammation. These preparations can be applied directly to the affected areas to provide targeted pain relief. Baths. Another effective way to relieve pain is to use borax in baths. Soaking in a bath enriched with borax allows the minerals to be absorbed directly through the skin, resulting in quick and effective pain relief. Continue, please write can. Borax baths are particularly effective in treating muscle pain and inflammation as they have a relaxing effect and promote circulation. To prepare a borax bath, simply dissolve an appropriate amount of borax in warm water and soak for about 20-30 minutes. Repeat this process regularly for long-term pain relief. Having looked at the various uses of borax for different types of pain, it is important to note that the dosage and use of borax may vary depending on individual needs. It is advisable to consult with a qualified physician or naturopathic doctor to determine the best course of action for your specific situation. Dosage and safety of borax. Proper borax dosage is crucial to its effectiveness and safety in treating pain and other health problems. Too low a dosage may be ineffective, while too high a dosage may result in unwanted side effects. Therefore, it is important to follow recommended dosage guidelines and consult with a qualified physician or naturopathic doctor to determine an appropriate dosage. The recommended dosage of borax can vary depending on the application. When treating pain and inflammation, a daily dose of 20-30 mg of borax per kilogram of body weight is often recommended. This dosage can be taken in the form of borax preparations available as dietary supplements. It is important to measure the dosage accurately and not to exceed it to minimize the risk of side effects. Borax is generally safe when taken in recommended dosages, but there are some factors to consider to ensure safety. People with kidney problems or other serious health problems should not take borax without first consulting a doctor. Pregnant women and nursing mothers should also be cautious and consult their doctor before taking borax. It is important to use high-quality borax supplements from trusted sources to ensure the purity and quality of the product. Be sure to follow label directions carefully and always consult a qualified healthcare professional with any questions or concerns. Experience reports and case studies. Testimonials and case studies can provide valuable insight into the effectiveness and use of borax in treating pain. Many people have had positive experiences with borax and report significant relief from their pain and an improvement in their quality of life. A report from a person suffering from chronic joint pain describes how daily intake of borax led to a significant reduction in pain and swelling. The person reports that after only a few weeks of taking borax, he noticed a noticeable improvement in his mobility and quality of life. Another case study describes the experience of a person with fibromyalgia who used borax as part of their holistic treatment strategy. The person reports that borax helped reduce their muscle pain and fatigue and improved their sleep quality. They describe borax as a safe and effective option to complement their conventional treatment methods. These testimonials and case studies are just a few examples of the many uses of borax in treating pain. They show that borax can be an effective and well-tolerated option for pain relief for many people. However, it is important to note that experiences may vary from individual to individual and that borax is not suitable for everyone. It is advisable to consult with a qualified doctor or naturopathic doctor before taking borax to treat pain. Side effects and risks when using borax. Although borax is generally considered safe when taken in recommended doses, there are some potential side effects and risks that should be considered. The most common side effects of borax include gastrointestinal upset such as nausea, vomiting, and diarrhea. These side effects can occur if borax is taken in too high doses or if it is used for a long period of time. There are also some rare but serious side effects of borax that should be noted. These include kidney problems, liver damage, and neurological problems. These side effects can occur when borax is taken in extremely high doses or when it is used for a long period of time. People with pre-existing conditions or other health problems may be at higher risk for these side effects and should use borax with caution. Pregnant women and nursing mothers should be especially cautious and only take borax after consulting a doctor. There is limited data on the safety of borax during pregnancy and breastfeeding, so caution is advised. It is recommended to avoid borax during these times or only take it after consulting a doctor. It is important to use high-quality borax supplements from trusted sources to minimize the risk of side effects. Be sure to follow dosage guidelines closely and not to overuse borax. If you notice any side effects or have any concerns, you should stop taking borax immediately and consult a doctor. Another potential risk with using borax is the possibility of overdose. Although borax is generally safe in recommended dosages, excessive intake can lead to serious health problems. Symptoms of borax overdose can include gastrointestinal distress, kidney problems, seizures, and neurological disorders. It is important to follow dosage recommendations closely and not to take borax beyond recommended amounts. It is also important to note that borax is not suitable for everyone and that certain people may be at higher risk for side effects. People with kidney problems, liver disease, neurological disorders, or other serious health problems should only use borax under medical supervision. Pregnant women and nursing mothers should be especially cautious and only take borax after consulting a doctor. In summary, borax is generally a safe and well-tolerated remedy for pain relief and promoting overall health when taken in recommended dosages. It is important to follow dosage guidelines closely and not to overuse borax to minimize the risk of side effects. If you have any questions or concerns about using borax, you should consult with a qualified healthcare professional or naturopathic doctor who can assist you. Comparison of borax with other painkillers. Borax offers a natural and cost-effective alternative to conventional painkillers such as NSAIDs, non-steroidal anti-inflammatory drugs, and opioids. Compared to these drugs, borax has the advantage of having fewer side effects and a lower potential for addiction. It is also effective in treating a variety of types of pain, including joint pain, muscle pain, nerve pain, and inflammation. NSAIDs such as ibuprofen and aspirin are often used to treat pain and inflammation, but carry the risk of gastrointestinal upset, stomach ulcers, kidney problems, and cardiovascular disease. Long-term use of NSAIDs can lead to serious health problems and should therefore be used with caution. Opioid painkillers such as morphine and oxycodone are effective in treating severe pain, but they have a high potential for dependence and can lead to serious side effects such as respiratory depression, addiction and overdose. Long-term use of opioids should therefore be avoided due to the associated risks. Borax offers a safe and effective alternative to these medications, especially for people looking for natural treatment options or who want to avoid the side effects and risks of conventional painkillers. It has anti-inflammatory, analgesic and neuroprotective properties that make it a versatile and effective pain relief agent. Overall, comparing borax to other pain relievers shows that borax is a promising option for treating pain and inflammation, especially for people looking for safe, effective and natural treatments. Borax in naturopathy. Borax has a long history of use in natural medicine and is still used today in various traditional medicine systems around the world. In Ayurvedic medicine, borax is called tankan and is used to treat indigestion, skin diseases and joint pain. In traditional Chinese medicine, borax is called peng sha and is used to treat fever, stomach upset and skin problems. In Western natural medicine, borax is often used as a dietary supplement to support bone health, detoxification, and pain relief. Borax is believed to improve bone health by regulating calcium and magnesium metabolism and increasing bone density. It is also used to remove heavy metals from the body and promote overall health. Borax is often used in combination with other natural remedies to enhance its effects and achieve the desired results. For example, borax is often combined with herbs such as turmeric, ginger, and boswellia to enhance its anti-inflammatory effects and improve pain relief. These synergistic effects make borax a popular ingredient in many naturopathic treatment protocols. In natural medicine, borax is often considered a safe and effective alternative to traditional medications, especially in the treatment of chronic pain and inflammation. Many people are looking for natural treatment options that have fewer side effects and less potential for addiction than traditional medications. Borax offers one such option because it is well tolerated and offers a variety of health benefits. In naturopathy, borax is often used to treat conditions such as arthritis, rheumatism, osteoporosis, muscle pain, gout, and fibromyalgia. It is also used to detoxify the body, promote digestive health, and support the immune system. The versatile uses of borax make it a popular ingredient in naturopathic practice. Borax is used in natural medicine in a variety of forms, including supplements, ointments, creams, tinctures, and baths. The choice of dosage form depends on the type of ailment and individual preference. Some people prefer to take borax orally, while others prefer to apply it topically or use it in baths. However, using borax in naturopathy requires careful dosing and application to achieve optimal results and minimize the risk of side effects. It is important to follow dosing guidelines closely and consult with a qualified naturopath or physician to determine an appropriate dosage. Overall, the use of borax in naturopathy shows that it can be an effective and versatile option for treating a variety of health problems. Its anti-inflammatory, analgesic and detoxifying properties make it a valuable ingredient in many naturopathic treatment protocols. Conclusion. In this book, we have covered in detail the use of borax for pain relief and promoting general health. We have explored its long history of use in various cultures and medical systems, examined its biochemical properties, and reviewed the scientific research on its effectiveness. We have found that borax has anti-inflammatory, analgesic and detoxifying properties that make it a versatile and effective remedy in the treatment of pain and inflammation. Borax has been shown to be effective in the treatment of joint pain, muscle pain, nerve pain and general inflammation. We also explored the different ways to use borax, including oral ingestion, topical application, and use in baths. Each method of application offers specific benefits and can be selected based on individual needs and preferences. Additionally, we looked at the dosage, safety, side effects, and risks of borax and found that it is generally safe when taken in recommended dosages. However, it is important to follow dosing guidelines closely and consult with a qualified healthcare provider or naturopathic doctor if you have any questions or concerns. In conclusion, we have examined the use of borax in naturopathy and found it to be a popular and effective option for treating a variety of health problems. Its versatile uses and good tolerability make it a valuable ingredient in many naturopathic treatment protocols. Overall, this book shows that borax is a promising agent for pain relief and promoting overall health, and that further research and clinical trials are needed to understand and utilize its full potential. It is hoped that this book will help to promote awareness of the many uses of borax and help people support their health in a natural and holistic way. In this day and age, when many people are looking for natural alternatives to conventional medications, the use of borax as a natural pain relief method is gaining popularity. The information presented in this book provides a comprehensive overview of the use of borax for pain relief and its many uses in natural medicine. It is important to emphasize that using borax for pain relief requires a holistic approach that includes a healthy lifestyle, a balanced diet, regular exercise, and stress management. Borax can be a valuable addition to these measures and help reduce pain and promote overall health. However, it is also important to have realistic expectations and understand that borax is not a miracle cure and that it may not be right for everyone. Each person is unique and responds differently to treatments. So it is important to tailor the dosage and use of borax to the individual and consult with a qualified doctor or naturopath if necessary. In conclusion, using borax to relieve pain and promote overall health is a promising option that continues to be researched and studied. With the right information and an informed decision, people can consider borax as part of their holistic health practice and reap the benefits of this natural treatment method. Borax to go. Der Einfachwegzerschmerzfreiheit. Rights and ownership notice. This audiobook is published and distributed by Testbericht LLC. All copyrights, publishing rights, distribution rights, audio rights, and related intellectual property rights for this work have been lawfully and exclusively acquired by Testbericht LLC. Testbericht LLC is the sole and unrestricted rights holder of this audiobook, including the right to reproduce, distribute, publish, monetize, and publicly perform the content on digital platforms such as YouTube. The original manuscript files, source documents, and contractual acquisition records serve as proof of lawful ownership. The original author and/or their authorized representative, Renovatio LLC, has transferred all relevant rights to Testbericht LLC in accordance with applicable copyright and publishing law. This ownership applies to all current and future uses of this work, including audio, video, and digital publications. Effective date of rights ownership: the 1st of February 2026. Any unauthorized use, reproduction, re-upload, redistribution, or claiming of this content is strictly prohibited. Copyright Testbericht LLC. All rights reserved.